Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome back to another very interesting video. What we have here is the aftermath of otitis externa. Oto meaning ear and itis meaning inflammation, and externa because it's the external ear. So this has been a bacterial infection of the ear canal basically. And what we have here, this kind of pale, whitish, creamy, kind of cottage cheesy type debris in the ear canal is dead skin. So the pale stuff is rapidly and freshly shed dead skin from the ear canal as a result of the infection. So I've shown a couple of cases very, very similar to this before, but just to bring you up to speed, this is something we call acute diffuse disquamation. So disquamation is just shedding of skin, which is derived from Latin for disquamus or disquamare, meaning like taking the scales off a fish, so that's where the word comes from, disquamation, shedding of dead skin. And acute diffuse just means that this disquamation has happened very, very quickly within a short space of time, and it's happened throughout the ear canal, not just in one little segment. So tons of dead skin here, and the reason that this has happened is because when bacteria enter your living tissue, so when a foreign invader, this is just sodium bicarb that I've applied, that's why everything looks wet at the moment. When bacteria enter your living tissue, they will eventually be intercepted by white blood cells called sentinel cells. And sentinel cells are just white blood cells that are kind of stationed around your body within tissue. So that might be a dendritic cell or Langerhans cell or a mast cell. And basically what happens is when the white blood cells detect the bacteria, they will release lots and lots of chemical signals, which will cause the blood vessels in that area to dilate, and then that basically kickstarts the inflammatory process. And somewhere in that process, what will happen is that these white blood cells, these macrophages, will release something called growth factor, and those are chemical signals. Basically, during this process of inflammation, there are just chemical signals flying everywhere. But one of those chemicals is called growth factor, and that growth factor will stimulate the skin cells of the ear canal to start producing very rapidly. So that's what we call rapid cell turnover. So the skin cells deep in the epidermis are dividing, pushing up the skin cells above and leading to a rapid shedding of dead skin. So that's what's happened here. Now I know that this was an infection because the patient, it's a somewhat interesting case, but the patient is a hearing aid patient of mine. So he's a farmer, and throughout his many years of exposure to machine noise and also age catching up with him, he's lost a lot of his high frequency hearing. So I've treated that with hearing aids. But he came to me and he's not the type of person to go to the doctor. So he said to me about 6 weeks ago, my hearing aid is whistling. Now when an audiologist hears that, we usually suspect wax, because the sound that's from the hearing aid that's delivered to the ear canal, if there's any debris in the way, that sound will bounce off the debris and leak out of the ear canal back into the microphone, just like when you're at karaoke or like a concert and something's turned up too high or the microphone's too close to the speaker, you get that horrible like ear-splitting, ringing, whistling. That's kind of what feedback is like. So immediately I'm thinking wax, so I'm going, yep, fine, no problem. And then he said, oh, and also my ear was getting wet, like it would just be wet for ages. And then I'm thinking, okay. So I asked him, is that kind of wetness, does that have an odor? And he said, yes, it did. So immediately I thought, okay, there's been an ear infection. So he said that was, several weeks ago. So he didn't go to the doctor. He just kind of tolerated it until it cleared up. But as soon as he said that, I thought, right, this is going to be a suction job. There's going to be loads of dead skin to clear out. And of course there is. So what I'm doing here, and you can see this kind of sheet of pale dead skin here. What I'm doing is I'm kind of stripping everything away. Now, normally I wouldn't put in quite as much effort as I'm putting in right now. So if you look at the other cases I've shown before, I suction away most of the stuff, but there's usually a lot of debris left behind. But in this case, I want to put in just a little bit more effort because I can almost guarantee that if this infection reoccurs, this patient will not go to the doctor. So I'm trying to kind of find opportunities to strip away what I can and get rid of as much dead skin as I can so that the infection doesn't reoccur. Because what happens is when you have dead skin, basically bacteria like to eat and of course live on and colonize on dead skin. And that's what we call biofilm, and which is basically like plaque on your teeth. That's just like a mature colony of bacteria, and that's why it's so important to floss, right? So the flossing, I mean, if there are any dentists watching, correct me if I'm wrong, but really the flossing isn't like cleaning the teeth per se very well, but what you're doing is disrupting that biofilm that will colonize and live between your teeth. So what I'm doing here is trying to deny any opportunity for this bacteria to proliferate. Now bacteria, like, you know, there'll be lots of bacteria and fungus that live on your skin and in the ear canal. That's fine, but what I don't want to happen is for that bacteria to form these mature colonies and these mature biofilms on this dead skin, only for him to then grab his finger and then itch his ear and then create a tiny little laceration, and then the whole process restarts. Because that's probably what's happened. He's shoved a dirty finger in his ear and then done that. So the eardrum there, it does look inflamed, I have to say, but there's no longer any pain, there's no discharge, there's no obvious swelling. So really, I mean, I wouldn't necessarily say, oh, there's inflammation of the eardrum and therefore there's an infection. I would just say that the eardrum looks a little bit erythematic. So, and that just means red. So if you ever see something in medical notes that says erythematic or erythematous, or like there's erythema in the tissue, that just means redness, which, you know, by itself probably doesn't mean a huge amount. So, you know, hallmarks of inflammation would be redness, pain, swelling, heat, and so on and so forth. And there's only one sign there. So I rather suspect that, again, that's just, you know, the aftermath of the infection. And again, any kind of undue wetness that you see, that's just me applying sodium bicarb to the ear canal. You know, for cleaning up dead skin like this, I find that sodium bicarb is a little bit more helpful than olive oil. And you can see here, I'm just teasing, just to see if I can peel away any more. And what I'm doing here, you have to be incredibly careful here, because if I create any break in the skin, then it's kind of defeating the point, because again, you're just creating another entry point for bacteria to get in. So when you're doing kind of peels like this, you have to be extremely careful. You know, it's kind of risk versus reward, right? So you want to peel away as much as you can, but you don't want to create any breaks in the skin. And right around here, I think this is probably where I finished the procedure. So what I've done is I've actually got both my hands kind of resting on the patient's head, and with my left hand that's holding the endoscope, I've got my hand deliberately kind of resting on his cheek so that I can feel when he's kind of clenching a little bit, so I can feel the muscles in his face, basically. That's quite a common technique. And right here I could feel him clenching a little bit, which means that he's finding it uncomfortable, which means that I'm applying too much pressure, so I'm being heavy-handed, which ultimately means that that's a little bit too difficult to get. But nevertheless, from where we started, it's a fairly good outcome. You know, most of the dead skin is gone, and again, the ear canal is looking very clear. Lovely red-looking eardrum there, but again, I don't think that's anything to worry about. And again, just catching a little bit more dead skin here. So, you know, I wanted to show this because it perhaps shows a sort of an approach and a technique that I've not really shown before on the channel. Just kind of going the extra mile a little bit to clear away this dead skin. But again, kind of desperate times call for desperate measures, really, because, you know, I just wanted to help the patient out, because I know for a fact, just due to how he is, he wouldn't even contemplate going to his local doctor unless he was dying. So, you know, we're really just trying to prevent any kind of further infection. And consequently, after I performed this procedure, you know, popped the hearing aids back in, and he was, you know, in the land of the living. You know, he could hear again, which he was extremely pleased about. So a little bit of fluid there, that's just some residual sodium bicarb, so nothing to worry about there. But there we go. I thought that was quite a nice procedure. I hope you enjoyed that. If you have any questions or comments, leave them down in the description box below, and I will try my very best to get back to you. And of course, I will see you guys on the next video.